Hi, I'm Dr. Susan Vasko. Thank you for submitting your questions on Facebook, and we have a couple questions today to go over. The first one was, do you need to lose all of your weight before getting a tummy tuck for the best result? What I generally tell my patients is you should be pretty close to the weight that you are pretty happy at. We all have that ideal body weight that it says on the insurance chart that we really aren't going to be able to maintain without just going crazy with starving ourselves and working out every day. But if you have kind of a happy weight that you're comfortable with a reasonable diet and exercise program, then that would be the good weight to have your tummy tuck. Now, you don't have to be exactly there. I usually tell my folks that if they're within about 5 pounds of that weight, you can budget me in a little bit because I'll take off some weight with the tummy tuck. And sometimes people also have some trouble spots. Maybe they're close to the weight they want to be, but have some issues with hips or thighs or that sort of thing. Then they may also be having some liposuction with the tummy tuck, and that can also reduce the weight just a little bit. But bottom line, as close as you can be to your happy weight is the nice weight to have your tummy tuck performed. The second question is on a whole different topic, and that is asking what filler is recommended for nasolabial folds. And nasolabial folds are these parentheses lines that or smile lines that we get. Some of it's genetically programmed that I'll see folks even in their 30s that have deep nasolabial folds. Some people can be 80 and never have them, but usually they get a little bit worse as time marches on. I like fillers better than doing fat injections. It seems more predictable, and our fillers, for example, Juvederm, are nice in that they should last you about 8-9 months. We have some newer fillers that might last longer, but someone having an injectable for nasolabial folds that have never had it before, I generally would start with Juvederm, and typically one syringe, which would be about close to around $700, lasting 8-9 months. Some people with deeper nasolabial folds might take 2, even rarely 3, but kind of week in and week out, the average person uses 1 syringe of Juvederm. And like I mentioned, we have some newer fillers that may last a little bit longer, but if you've never had a filler, I would start with Juvederm, see how you like it, and then the patient and I can kind of get a feel for what their needs are and maybe adjust from there. Well, thank you for visiting our Facebook page and submitting questions, and we look forward to more questions from our Facebook followers, and of course, always love to see you in the office here for a consult.